So talking about aseptic technique, aseptic technique is a thing that what both healthcare providers should be aware of, and also patients to be aware of. It's a patient's right for me to actually ask, like, if I'm a patient, I should ask you that, okay, I hope everything in the theater has been sterilized, clean, disinfected, and all of that, you know. So aseptic technique is just a set of practices by healthcare professionals to prevent the spread of infection. Now note, if you are going to a hospital, the hospital bed you are going to actually lay on, several patients have laid there. Do you understand? So the only thing that will make it still good is what, if the bed sheet was washed, disinfected, and all of that. If you are going to this surgery room, it's not every instrument they use in the surgery room that is just one time use and discard. It's not all of them, so you basically ensure that things are properly done and all. So it's about creating and maintaining an environment that is free of any harmful organisms like bacteria, viruses, fungi are basically free. So purpose and importance is it prevents healthcare associated infections, so that you don't go to the hospital with a different infection then get another infection. Protects both the patient and healthcare workers, because even the healthcare worker, I told you that this is a patient and healthcare worker business. As a healthcare worker, as you are working in that hospital, you are trying to save life, you might lose your life. It's essential during procedures that break the skin, anything that have to do with going into the skin. So you are very very you are very very careful as a healthcare provider or as a surgeon not to introduce an infection directly to a patient. So key elements of this aseptic technique is barriers, sterile gloves, gowns, masks, drapes. Prevent transfer of pathogens from what healthcare workers or environment, patient and equipment preparation. So these are different ways. They can sterilize the towels they use, sterilize what the injections, sterilize all those surgeon, the gloves, wash your hands, and all of that, just to ensure that what there's no spread of infections in the hospital. So sterilizing instruments, cleaning the patient's skin with antiseptics, environmental controls, keeping the doors closed during procedures, limiting personnel in the room. Not everybody should go into the theater. Alright, if you are going into the theater, like from my side, usually keep your shoes outside. You wear the theater shoes. So this is just it. So when is it you during hospitals and biopsies, when you are trying to insert catheters, insert what intravenous lines or chest tubes, we are trying to dress wounds or cuts, right? We are trying to deliver babies or any vaginal examinations.